So our first question, I'll start with Dr. Rogers. We're going to talk a little bit about the early stages of detecting and managing COVID. Dr. Rogers, how would you go about identifying sick patients, particularly patients in the rural areas? One of our doctors from India mentioned that 70% of the population is in the villages and rural areas. Can you give some advice along those lines?
Yeah, on this front, I really agree completely with Dr. Rohatgi. In her introduction, she mentioned that the most important thing is how the patient looks and what their oxygen level is. And so I do think having a home oximeter where you can carefully monitor your loved one and make sure that their oxygen is safely over 90 is important. And secondly, do they look like they're working really hard to breathe? If they're breathing comfortably, their oxygen's 92%, then that's a person that I feel okay watching. If they're looking like they're breathing like they just went running, they're taking deep breaths, having to use the muscles in their neck and working hard, that's a person that I'd really, really want to get in to be seen if I could. And also that person more likely needs oxygen. If you don't have an oximeter at home, that's someone I'd be much more worried about. And we use those same measures, to be honest, when we're at Stanford Hospital and have all sorts of resources. I care much more about how the patient looks than I do about their lab numbers.
Thank you. Dr. Maha, as an emergency doctor, some people do okay for 1 to 3 days and then suddenly get very sick. How should we identify early stage in which patients may get sick versus do better?
Certainly. So identifying potentially sick patients starts with identifying risk factors for severe disease and then monitoring for respiratory decompensation. So the risk factors that we think about are primarily older age, so age greater than 65 or age greater than 55 with any comorbidities themselves like diabetes or chronic kidney disease, cancer or immunosuppression, and then other conditions that you may not ordinarily think about as putting you at risk, like being obese or being pregnant. Once a diagnosis of COVID has been made, then we tend to screen our patients for these different conditions. And then once we've sort of assessed for these risk factors, as Dr. Rogers had mentioned, it's really about monitoring a patient's symptoms, what they look like, and their vital signs. And that's going to help us decide whether they could be monitored at home or whether they need to go to the hospital.
Thank you very much. Dr. Huja, we oftentimes have patients who have persistent low-grade fever. Can you comment a little bit on that as far as things you'd be worried about and things that to be considering?
Absolutely. Thank you, Dr. Ozdalka. So fever puts us at risk for dehydration. So the management of fever should include hydration. And then it is safe to take Tylenol if there is no significant liver disease, or anti-inflammatories, NSAIDs, ibuprofen, Advil, or the versions that you have there, as long as there's no significant kidney disease. So fever management is important, but of the different medications, I would say hydration is the most important.
And can I add on that, one question asked, on days when I feel feverish and fatigued, what more can I do besides steam and rest? Anything else besides what you just mentioned?
I think those three things would be the mainstay.
Great. Can I also ask you, and then I'll ask Dr. Subramani as well, your take on steroids at this point? Someone's at home and they're having symptoms. Any role for that in your opinion?
You know, and I'll address, and Dr. Subramanian, please add on. We don't recommend steroids if there is no significant oxygen need. We pair the steroid need with oxygen need. So if they're at home and oxygen levels are okay, no steroids, because the risk of harm is greater than the risk of benefit.
Excellent. Dr. Subramani, can I also get you to comment on that?
Sure. I think in this case, when people are at home, you know, really less is more, and there can be harm, as Dr. Ahuja said, from giving steroids at this point. And we're going to be talking about secondary fungal infections and other risk factors, you know, that complications that can happen when you give steroids at this point. So I really think I totally agree with Dr. Ahuja at this point. It's really paracetamol, brufen, fluids, and really good nutrition, taking rest, and no need for antibiotics at this time, no need to really go after getting all sorts of other medications, and getting a pulse oximeter, as Dr. Rogers said, to keep at home and keep an eye on really your oxygen levels are what's important at this time.
Dr. Subramanian, you mentioned Tylenol, paracetamol. How about piroxicam? That was one question as well. Any issues with that?
Yeah, I think any non-steroidal anti-inflammatory can be safe at this time, as long as people have, they know they have normal kidney function or they don't have other risk factors. So I think, we encourage people to take these types of medicines and take rest.
And Dr.
I just wanted to, Errol, I'm sorry, just wanted to add out here that, not so long ago, there were these scare stories about NSAIDs based on a study that was done in Korea. It was a retrospective study, and it's a small study that showed that if you took any of these anti-inflammatory, the chances that you would deteriorate is more. This, I guess, has been put to rest now. Just wanted to make this, highlight this area, because a lot of people still have concerns regarding taking NSAIDs in India. Yeah, thank you. Sorry.
Thank you, Dr. Samir. And perhaps, Dr. Subramanian, can I also get you to comment? One question came up, patients at home, they're relatively doing well. Is there any indication to get labs done, inflammatory markers checked?
We don't really recommend that at this point. It doesn't change your management. And we have to remember that most people do get better. If they have fever and mild upper respiratory tract symptoms, they do get better with rest. So there's no need for those markers unless they're getting worse.
Thank you. Moving on more to home management, Dr. Barman, as an outpatient COVID doctor, you oftentimes may have patients who feel short of breath, but you know that they're otherwise doing well. What things are you thinking about? What recommendations do you have to manage these patients?
That's a great question. And I see a lot of my patients are short of breath, very, very common. If they do have an pulse oximeter, that is really helpful to get a concrete number. If the number is good, that's reassuring. And we do monitor most of our patients remotely, either by phone calls or video, and found it safe to do so in most circumstances. If someone is reporting a low pulse oximeter number, the first thing we actually verify with them on the phone, on video if possible, that number is correct. As we have a lot of patients will get the pulse number and the pulse ox mixed up. They might, we educate them to put it on a couple different fingers. If someone is feeling short of breath and is having significant chest pain and has a cardiac history, we're not going to waste time. That could be a sign of a cardiac event, regardless of pulse ox. If they actually look and feel pretty well, I will have them at home. We do what we call an ambulatory pulse ox. Okay, check your oxygen level right now. You're sitting down talking to me. It's 95%. That's great. And then I have them stand up and just march in place and check their pulse ox to see if that's dropping. If I have any concerns, if they are having other symptoms such as feeling dizzy, severe fatigue, difficulty walking around, difficulty doing their activities of daily living, or if their oxygen levels drops when they're walking, I'll bring them into clinics for further assessment. We do sometimes do EKGs or possibly chest x-rays. I do find in a large amount of time, the workup is negative. And part of it is knowing about COVID and the severe anxiety associated with it. So we do spend a lot of time reassuring patients.
Great. Thank you very much. I want to go to the next question. Dr. Ahuja, talking about the inpatient management of a typically hospitalized COVID patient, someone who's not in the ICU. We talked a little about measuring labs and markers. How frequently should we be measuring these things? Does it matter so much?
Inflammatory markers need to have a clinical correlation. So while we have seen a correlation between D-dimer, CRP, and at times some of the acute phase reactants, it really needs to be correlated with the symptoms of the patient. Some people recommend trending the D-dimers, but we haven't really found that to be helpful as long as we know that their respiratory status is okay, et cetera. So given that resources are limited, nurses are stretched, patients don't need to give blood unnecessarily, we would say not to trend it and just go with clinical.
A little bit on diagnosis using high resolution CT scans, which we know is very commonly used in India. Dr. Ahuja, can you comment a little bit on that and the role of it and the value of it?
Certainly. Thank you, Dr. Asdalga. So a high-resolution CT scan should only be ordered if a patient is clinically deteriorating for an unexplained reason. So if the patient is on oxygen, not improving with oxygenation, and you're worried about either ARDS or worsening pulmonary infiltrates or a pulmonary embolism, which may require the angiography component to the CT, that's when it's indicated. Otherwise, a chest x-ray or really just clinical symptoms, given how limited resources are, would be adequate. In the US, we are using a point of care ultrasound at times when we can. I understand that that is not as readily available, but we hope that given the cost effectiveness of that, that might be a more readily available resource in the future.
Any other, from your perspective, any other things to consider about using CT scan?
No, I agree 100% with Dr. Ahuja. That for most people, it's not necessary unless you have a question about something other than COVID. I do understand that sometimes the turnaround time for the nasal swab can be many days. And so if it's easier to get a chest x-ray and that looks consistent, it happened here that when we were in our major surge, when it seemed like COVID, it was COVID. And unfortunately, that's probably what you're going through too. So if you have classic symptoms and a chest x-ray that looks like it, I would not get a CAT scan as well. I agree with her 100%.
We did want to talk a little bit about mucor mycosis. That's been a common topic that's also come up recently. Dr. Subramanian, could you please tell us a little bit about that in regards to COVID-19?
Sure. It's a really rare fungal infection that we see in people with low immune systems or people whose blood sugars are out of control. And it's become more common now in patients who have had COVID-19 because I think we're seeing high use of steroids, sometimes overuse of steroids without controlling the blood sugars. And steroids themselves do cause immunosuppression, especially when you give them long-term or at very high doses. So that was what I was trying to talk about, really sort of limiting the use of steroids to those who really need it. Controlling blood sugars is very important. And what should you look out for? People are quite nervous about it. If people develop a sinusitis and they have any black or dark discharge from their sinuses after they go home, it's usually after you're recovering from that acute COVID episode. It can start in the sinuses and go back into the brain. So it's something that really needs to be looked into quickly. It can affect the lungs as well. If somebody's coughing up blood, it's a bad sign. And so, and what should you do about it? Really, the thing to do is to involve surgeons quickly. ENT surgery specialists are the ones who do a lot of the debridement, and surgical debridement is the treatment of choice. Antifungal medications can be very caustic. They are just adjuncts to the surgical treatment, but really sort of getting it early, watching for it, trying to do things to prevent it are the best way to go. This fungus is something that's in the soil, it's in decaying fruits and vegetables, it's all around us. So we're all breathing it in, and it's only people who are at risk who develop the actual infection.